Hello, my name is Dr. Castilla, and in today's video we are going to talk about how to take care of your retainers. After you are done with your orthodontic treatments with either Invisalign or braces, you are going to want to keep that smile looking really good. And in order to help you do this, you're going to have to wear, guess what? Retainers. So therefore, it's important that you not only take care of your retainers, but also that you wear them exactly as instructed by me. And that way your smile will just stay beautiful for years to come. So to help you out with this, I've created a retainer checklist. So first, let's talk about the differences between full-time wear and nighttime wear. When you first complete your orthodontic treatment, your teeth are going to be very vulnerable and they're going to want to move back to the way they were, and we don't want that to happen, so we will ask you to wear your retainer full-time. Full-time means 24 hours a day, except unless you are brushing your teeth, of course, or eating or drinking something other than water. Other than that, they are in. After a while, usually for most people about 8 weeks, but it just depends on your case. But usually after about 8 weeks, we will switch you to nighttime wear. And for nighttime wear, just means that you wear them for 8 hours during the night. So if you sleep only 4 hours, you still gotta wear 8 hours. So maybe put it in a little bit early before you go to bed. So full-time wear, 24 hours, nighttime wear, 8 hours. Okay, so let's talk about your retainers. The retainers, for the most part, that we will be giving you in our office are called S6 retainers or clear retainers. You will get two, one for the upper and one for the lower. And in addition, you will get a bonded retainer, and that is a wire that is bonded to your lower canine teeth. And the reason we put this on the lower, because the lower is the template for the mouth, meaning we always match the upper teeth to fit the lower teeth, not the other way around. And with time, the lower incisors are the ones that tend to want to relapse or move back the most, more than other teeth. So to put in your retainers, you simply line up the retainer with your teeth. Let's move this one out of the way. Line them up like that. This is your upper, and then you just snap. That's it. Okay, it's always good to just push it in. Don't force it. If you feel like you're forcing it, it's probably not going in the correct way, or you don't have it aligned with the correct teeth. Okay, so we'll do it again for the lower. This one will fit even with your wire in place. So you just line it over your lower teeth till you are sure that you got it. Push in the front, and then sometimes you have to snap in several places, but you will definitely hear a little snap. And there's your upper and your lower, and on the lower fitting with the bonded retainer. Okay, so one thing that can be a little tricky at first when you first get your retainers is removing them, because they do fit a little snug, and we want them to, because we want them to retain your teeth. So one thing you always want to keep in mind is you always want to use your fingers and lift the retainer off the back. You don't want to try to remove it like this in the front with your nails. You want to go from the back. So for example, this is the upper retainer, and you want to lift from the back, and this is what I mean. So lift, okay, and then you lift in the back, and then it just comes off. Okay, if you try to lift it from the front, and usually sometimes what I see people do is going like this, what will happen is you will introduce cracks into your retainer, and once you introduce a crack, then it's very easy for it to break. And on the lower, it's the same thing. You lift it from the back. Obviously in your mouth it'll be a little bit different, because your hand will be going in from the back. And you lift it from the back. This one's very snug. Okay, and on the lower, what you don't want to do is dig your thumbnails. This is what I see some people doing, is digging their thumbnails to try to lift it off the front. So no to the front, yes to the back. So now we're going to talk about how to keep your retainers clean. Honestly, the best way to keep them clean is to brush your teeth after you have a meal and before reinserting them, especially if you're wearing them full time. If you're wearing them nighttime, then you won't be wearing them while you're having meals. But you have a couple of options for cleaning your retainers. One is to soak your retainers in white vinegar. You can do that for 15 minutes just as needed, or you can do it every day if you'd like. And the other option, if you don't like the idea of vinegar, is to use a product such as Retainer Bright. And Retainer Bright is a product that comes in little tablets that you dissolve in water, and you can buy that at any drugstore or Amazon or any places like that. But either way will work. Actually, vinegar works really well. This is what we mostly recommend in our office. It is a natural cleanser, and it won't leave a funny smell or anything with your retainers. Actually, will do a really good job at cleaning them. But if you don't like that idea, you can always use Retainer Bright or other retainer cleaning products that you can find at the drugstore. So after you soak your retainers in a cleaner, whether it's vinegar or Retainer Bright or some other retainer cleaner, you may still find that there is a little bit of debris inside of your retainer, especially if you didn't brush your teeth after putting your retainers back in, but that's okay. So to get the debris to come off from the inside, you are just going to need a small toothbrush, preferably wet, just with water. You don't want to use toothpaste or anything like that, because many of today's toothpastes have abrasives, and those are there for teeth whitening and stain removal of teeth. But these abrasives can scratch your retainer, and once your retainer is scratched, you can pick up odors and things like that. You definitely don't want that. So just with a small wet toothbrush, I like using a kid-sized toothbrush because it has a small head. You just go in and just clean away, okay? And just go in, same thing on the other, go in on the inside and just very gently lift off whatever little debris may be in there. So now let's talk about something that is extremely important. And how do I say this? Don't lose your retainers. Your smile is beautiful, you worked hard for it, we worked hard for it, and we don't want you to not have a beautiful smile. So it's time to be a little responsible and make sure we don't lose our retainers. So we have a couple of little tips for you. The number one thing is very easy to remember. If it's not in your face, it's in the case. So if you just remember that, you will keep your retainer. It's when you leave your retainers in other places that are not your case when you can get into a little bit of trouble. So here's a few more things to consider. So you don't damage your retainers. First of all, you don't want to chew gum with your retainers. They will get stuck to your retainers and it'll be very difficult for it to take it off. You don't want to eat with your retainers, especially if you're eating something crunchy. You can crack them. And finally, you don't want to drink anything that is hot. They are made of plastic, so we don't want to drink hot chocolate or hot tea or coffee or anything like that, because I don't think they're really going to melt if you drink something hot, but they could warp, and I've actually seen that happen. So you definitely want to stay away from that. So after you are done with your orthodontic treatment with braces or Invisalign, we are going to monitor you for an additional year to make sure your teeth are staying beautiful. And those are called your retainer appointments or your retention phase of your treatment. And like I said, you're going to be coming for a year, not as frequently, but you are going to have retainer checks. At your retainer check appointments, it's very important that you bring all of your retainers, both upper and lower. A lot of times, sometimes people forget, especially when they're wearing them at nighttime. They come to their retainer check appointment thinking we just want to look at their teeth, but actually we want to look at your retainers as well, because we want to make sure that they are working really well and that they are functioning and doing a good job for you. Well, I hope this video was informative and helped you out in learning about your retainers and how to wear them and how to take care of them. But if you do have any questions, you can always give us a call here at our office.